So an epigastric hernia is a hernia protruding to the abdominal wall, more specifically in the upper part of the abdominal wall, between the umbilicus and the lower part of the breastbone, and it is usually on the midline. Usually a patient with an epigastric hernia complains of a swelling in the midline between the umbilicus and the lower part of the breastbone, and this can cause pain, and it becomes more obvious when a patient is standing for a long period of time, or coughing, or doing any intense physical activity. Well, I think an epigastric hernia can be aggravated by any situation which increases the intra-abdominal pressure. So it could be straining, coughing, and physical activity. Well, an epigastric hernia can, as I mentioned, can cause pain, but might be complicated by a condition which is called incarceration or strangulation. This usually happens when some fatty tissue can protrude through the hernia defect, and it's not possible to push it back within the abdomen anymore. Under these circumstances, the condition is called incarceration, and if the blood supply to the tissue is compromised, the hernia will strangulate. This is an emergency situation which might require emergency surgery. Not necessarily. It depends whether they are symptomatic or not. Usually, if epigastric hernia is causing pain, it would be advisable to perform an operation because of the risk of a complication such incarceration and strangulation, which I just mentioned.